maybe you can give us a little bit of an overview of the technology developed by Dune, kind of how it works. And then, as you know, Mark and I were part of a multi-institutional study that here in the U.S. at least evaluated your technology. You want to share us a little bit with how the technology works and what it's about?
Happy to. The margin probe technology has been in development for over 10 years. The device was developed by a group of scientists in Israel.
Okay.
And what they recognized 10 years ago was that there are some basic differences in the way that cancer cells and healthy cells respond to electric fields.
All right.
So they developed a technique. It's called radiofrequency spectroscopy. Basically applies a series of electric fields and captures what's reflected back. In a lot of ways, it's like an ultrasound, but where ultrasound is good at picking up differences in anatomical structures, the margin probe technology is really good at picking up cellular differences, in particular those differences that are related to cancerous changes. Things like the depolarization of the cell membrane, the increased vascularity, and the changes in the composition of the nucleus of the cells. So what we developed was a probe. It has a sensor at the tip that applies a series of electric fields. It captures what's reflected back and puts it through an algorithm. The big piece of the development of the tool was to develop an algorithm with thousands and thousands of pathologically evaluated points to train that device as to what is and what is not cancer. In order to test that, we then went and conducted a large-scale randomized trial, which you were part of.
Right.
That trial was a 600-patient trial. It was conducted in 21 centers, 18 in the United States and 3 in Israel. And that trial, the data from that trial were the foundation of an application to the FDA for the approval of the device.
Okay. For use here in the United States.
Exactly.
Okay. Is it clinically in use elsewhere in the world right now, Michael, or not?
Yes, it is.
Okay.
The device today is clinically in use in both Europe and in Israel.
Okay. Very good.